Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle in studio, waiting to get your phone calls. 888-630-9625. That's how you reach us here. 888-630-9625. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied. Well, here's your opportunity to figure out really how to do it without what? Drugs and without surgery. There is opportunity to take control of your health and to make your wellness quotient a whole lot better than what it is. But we do have a topic today, one that I think you're going to find surprising relative to what the fix is, because this typically in the traditional medical community is treated with surgery, steroids, medications, and maybe every once in a while, if they got their act together, they'll put you through a little physical therapy. Nevertheless, it is, in most situations, the odds are 70%. Those of you who have been diagnosed as let's go to surgery can actually turn this thing around. What am I talking about? I'm talking about herniated or slip disc or ruptured low back discs. And to talk about that and to help me out a little bit here is Dr. Leonard Poe. Hi.
Hey.
We're going to sit and chat again.
It's always fun.
It's a good, I know. I take a beating. Anytime that you're in studio, I have to watch myself. But that's okay. It keeps me sharp and it keeps me moving, and the brain doesn't go into atrophy, and, I don't suffer from dementia, and, I know, never mind.
You're setting yourself up already.
I am. But see, every once in a while I have to give you a short lob, And this Wednesday evening, I know you're going to talk about this subject in office. And, there's so many patients that we see that have back pain with leg pain by itself. And their physicians have told them the only way out is surgery.
Isn't it?
Or depriment.
That's all you can do.
That's what they told me.
Yeah.
They told me that because of the 4 discs that I have in my low back, that I wouldn't be able to work again, and that I needed spinal fusion and so forth and so on. But you guys fixed that for me. It's a good thing. I appreciate it. Thank you.
You're welcome.
Okay, so let's talk about the subject a little bit here. Herniated low back. There's 2 areas of the spine that seem to be the most involved, and that's lumbar 4 and 5 and lumbar 5 and S1. There's a lot of people here that are listening that have had the surgery done already, and they still have pain.
Yeah.
And that's the problem. The success rate.
Statistics are not very good.
No, they're awful. Matter of fact, what they call success in the medical arena is 50-50. 50% of the people are deemed successful, 50% of the people are failures. For the kind of money that they're spending, that's kind of awful stats.
Yeah.
And the problem is when you further explore the success rate of the other 50% that are supposedly successful, simply that means that the pain doesn't get worse after that. It doesn't mean that the pain is going to go away completely. It just doesn't progress.
Yeah. Unfortunately, too, after surgery, it's a done deal down there.
So let's talk about this thing. Let's talk about percentage of population. Let's talk about, who's more susceptible. You're coming up on the 11th. Give us a little insight. What's happening with this bizarre low back? And no, I have a question before we can get into that.
Oh,
okay.
Here we go.
Yeah, my turn.
All right.
Okay. This is an easy one.
Just make sure you want to get the answer.
Yes. Be careful what I ask.
Yeah. Because I don't care that we're on the air.
I know you don't. Does everybody who have low back slip discs, herniated discs, that's what's causing the problem?
Not necessarily.
Thank you. I was hoping you'd say that.
Yeah.
Yeah. So you passed. You got an A.
Oh, thanks.
Okay. All right.
Well, I had a 50-50 chance.
Yeah, you
I
did.
guess.
It was either yes or no, but then you were going to leave me with something very difficult to talk about. No, seriously.
No, that's not the case at all. And, and honestly, with most people, and this is across the board, okay? This is pretty much all our patients that come in, and you'll agree with me. There's never just one thing. It's always a conglomeration of several different pieces. And even when we're talking about, now primarily with disc, and what we're talking about is structural problems. Okay, these are real simple mechanical structural problems. But there's always underlying biochemical problems. A lot of times there's underlying emotional problems.
Well, let's talk about the anatomy of that low back first. Let's talk about what it looks like and, the balancing act that's there. You have the shock absorbers. That's what we're talking about.
Those
right
are the
now.
discs.
It's called the disc. Mm-hmm. That allows people to pivot and turn and so forth. And it goes through a stage of progressive breakdown in some situations where you can have many different types of discs.
Right.
So some are protruded, and you have fragments.
Some are slipped, some are protruded. Some can get tears in there sometimes. It's it depends if the nucleus is moved around, the center middle part of the disc. It can be presented lots of different ways.
Well, the outside of the disc is like what? It's hard.
It's harder, and the way the fibers are aligned, the way I explain it to a lot of patients, it's kind of like that little Chinese finger trap toy. If you ever seen one of those, how those fibers are cross-weaved like that?
Chinese finger handcuffs.
Yeah. That's a lot of what it looks like. And the disc is great for straight up and down pressure, not so good with torque. And that's where a lot of people get into trouble. Because it's never, the guy coming in that's blown out his low back disc, he wasn't lifting a car off a child or anything like that. He's picking up the paper. He's getting a dish out of the dishwasher. It really is just enough of that pressure and torque over years and years and years of abuse of that low back that that's enough. That's the proverbial straw that broke the camel's back kind of thing, that it was enough to knock it out.
Well, the vertebrae are designed, the bones of the spine are designed to allow you to bend, twist, turn, and...
It's like a spring.
Yeah. And the motion's compounded, right?
Yeah.
And so you got this hard shell called the disc outside, the annulus. Mm-hmm. And inside there's a soft toothpaste-like stuff. That's called the nucleus. And that's what we call the traditionally the slipping of whatever. Right? And that breaks through the fibers, and it causes nerve compression or just a bubble that causes compression either on the cord or on the nerve root. So what's the compounded issue? It starts with something. Let's just talk mechanics. And we're going to get into the biochemical end of it because there's some interesting things like ileocecal valve and so forth we'll talk about later on. But the mechanics of the spine, to allow this to take place, something has to happen. What happens?
A lot of times it's loss of that curvature. If you look at the spine, okay, you've got two sets of curves that bend towards the front of you and two sets of curves that bend to the back of you. And it's like a big spring. And it's to allow pressure up and down and movement of those discs properly towards the right end. And when you start to lose that curvature, or you start to get reverse curvatures that a lot of people get in the cervical spine, we see a lot of times, it starts to push the disc in the wrong direction. And then it makes it very easy to get that thing herniated or bulged or slipped or, however you want to call it.
My guest in studio, Dr. Leonard Poe, your host and presenter this Wednesday evening, the 11th of September already, 7:30 p.m. at the Roselle Center for Healing, and he's going to be talking about low back disc herniations, the most common problem in the low back that is, the surgical knife, let's go get it done type of condition. And what we're trying to let you know is that it doesn't have to happen that way, and you can turn this, even though that you've been diagnosed as having a disc.
Simple conservative care will fix those things.
Yeah, most of the time.
Yeah.
About over 70% of the time. Yeah. And that's people who have been diagnosed with a frank herniation. The problem is that, as I asked you initially, that so many of these low back disc problems are either wrongly operated on, or they're misdiagnosed, or they're given things that actually perpetuate the problem.
Right.
And makes things.
And we'll talk about that.
And we'll talk about that as well during the program today. But meanwhile, 888-630-9625. If you'd like to talk to us and ask us a question about your problems, and it doesn't have to be on subject. And if you'd like to register for Dr. Poe's presentation this Wednesday evening and talk about your low back disc, 703-698-7117. That's 703-698-7117. And join us. I think that you'll find this presentation, particularly if you got a problem and you're on medication and you're on steroids and so forth and so on. Let's talk about how these discs mechanically, you said loss of curvature in the low back, and we know that the bones are inanimate objects. They have some circulation to them. They have a blood supply which feeds the disc.
They're living
as well. They're living.
Yeah, it's living tissue.
But the bone moves out of position, and when it locks out of position, it loses its biomechanical function. Now, in chiropractic, we call that a spinal subluxation. That just means that the vertebrae is misaligned millimetrically, just a little bit, and it's causing the disc to act abnormally. Now you have excessive torque and shearing and torsion on that disc space that ultimately leads to all this stuff that we're talking about. The osteopaths, by the way, call it a spinal lesion, but the mechanics are the same. So what happens? I know there's several phases of breakdown, from that initial misalignment, that abnormal juxtaposition, as we can call it. What's the process that ultimately allows that disc to break?
Oh, you're making this a complicated answer for me.
Well, you're a smart guy. You're a smart guy. Take one at a time.
Well, no, I know that.
One at a time?
Oh.
Not a problem.
I like to make things complex. All right, now, when you start, let's talk about those millimetric differences first, because it doesn't sound like a lot, but when you look at the body from a structural standpoint, biomechanics are biomechanics. Okay, just like in your car, just like in a machine, if things aren't lined up exactly right, if those things aren't attuned perfectly, then it doesn't run right. If you've got let's take a flywheel in a car, if that thing's loose, if that thing's off a little bit, it's not going to run right. You're going to get squeaking of the flywheel. Okay, and the same thing in the low back. If those bones aren't lined up just the way they're supposed to, when you go through motion, it's not going to move correctly. So you're going to start irritating all the soft tissue that's supposed to be supportive to it. You're going to start to break down. You will start breaking down the bone, and that's what degeneration is. You're going to start to get things like bone spurs, what we call osteophytes, where that bone starts to, when it's flat like that and it's not moving the way it's supposed to move, it starts to pancake out. And then we start to get more irritation in the tissue. It starts to break down the disc inappropriately, and that's when you get thinning of the disc. And now the problem with that is, discs are avascular. They don't have a good blood supply to it. So when you start to get actual destruction and wearing away, when you get disc material that's gone, that stuff doesn't really come back that well, and that's where people get in a lot of problems. Yeah,
and actually what happens is that the blood supply comes from the bone above it, so that's when you're moving and the disc begins to pump, so it sucks it in from the bone, but you're absolutely correct in that the disc doesn't have a direct blood supply. Matter of fact, at age somewhere between, some authors will say 18 up to about 22 years of age, that's when the direct blood supply to the disc drops off, and it's not there anymore. And so now it's susceptible to its environment, and we begin to see this progressive breakdown over a period of time.
That's why take any joint. That's why the biomechanics of your body are so important. Take any joint, and if it's not moving in that correct plane of motion anymore, you get breakdown. You get degeneration. You get wear and tear on it. Some of that is fixable. Some of that is, like when we talk about disc and cartilage, that's true destruction. It's very hard to get anything back.
So you get compression, the misalignment of the vertebrae itself. So we're talking about mechanical distortion, disruption to the disc material. So now going back to what you said initially, that shearing movement, that fast movement to one side or the other, where you had a little back stiffness and kind of ignored it, but now for whatever reason you decide to go play golf.
Yeah, golf is notorious. That's what I was already thinking before you said it. Golf's notorious for this because you go from a very static to a very dynamic movement in no time at all. It's very, very quick when you swing. And if you're not warmed up, if the muscles aren't nice and loose and you've already got mechanical irritation in there, then it's real easy to start making little tears and little bits, and you get things called fibrocytes, where you've got little tears in that fiber, and you start to get scar tissue. And scar tissue doesn't move the same way other tissue is supposed to move.
No, that degenerative change that takes place is loaded with the scarring, and anybody that has a scar on their skin knows that. And you just take a look at that. It doesn't move like everything else around it. Subsequently, the disc material doesn't move and accommodate to that mechanical pattern that it should have. And subsequently now you're more susceptible. There's a guy by the name of Joe Montana. You probably remember the name. I think he was a little bit before your time as far as being one of the great quarterbacks of all time.
Now, is this a joke how I'm young or you're old?
Never mind.
Okay.
But see, I know more than you do. It's just I've been on this planet a lot longer.
Yeah,
but
I remember Joe Montana.
Anyway, Montana took a snap out of center, stepped back, and he looked to one side of the field, and he twisted completely and through the other side of the field and completely herniated his low back. I mean, it was an immediate surgical situation. And one of our brethren, by the way, out in San Francisco did take care of him, along with his surgical team. So that's something, see, I know a little bit more about the subject than most people do. We're coming up for a break, and we have to be respectful to the people who are bringing you Dr. Tom Roselle Live. Have a whole lot more to talk about: ruptured low back discs, slip discs, discs that are leaking chemically and burning you. We'll be right back. Don't go away.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio waiting to take your phone calls on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied. Well, here's an opportunity. The opportunity to ask the question and find out if there's another way. We're always willing to take your calls. And by the way, if you don't want to call on air, you'd like to do it, outside on the computer or call our office, real easy thing to do. Go to rosellecare.com, rosellecare.com, and send us a note, and we will respond. I promise you we'll get back to you, so get that done, and we'll answer any question that you have. Or show up for Dr. Poe's presentation this Wednesday evening if you have a herniated low back disc or a disc that's causing you some trouble, or even if you're post-surgical, you've already had the surgery done. 703-698-7117, 703-698-7117. That's how you register for that class on herniated low back discs. And what we're going to teach you is that this is super fixable. This is not something that you have to live with. You can actually turn it around. Dr. Poe, I want to get back on topic here just for a little bit. Let's talk about what happens when you're diagnosed with a disc, or you have low back pain, or, we said there's a mechanical disruption, there's a shearing force, there's this thing called spinal subluxation, there's all these things. What happens? Doc puts these patients on medication, and they're usually NSAIDs, non-steroidal anti-inflammatories, or they're an anti-inflammatory all by themselves. They're loaded with all kinds of side effects.
Right.
It makes it worse.
Yes.
How?
Well, we talk about things like aspirin and that sort of thing in two ways. One, you take something like that, it's going to cause bleeding in the stomach. It interferes with the receptors in the stomach, so you can't get things like the other sulfates like glucose. Everybody wants to take glucosamine sulfate for that sort of thing. Well, if you're taking aspirin along with it, you're not going to get any of that into the body. It's not going to be absorbed properly. So you start to get, and just the other things like acetaminophen, and the liver's not going to work right. You're going to tear up the digestive system, so you're not going to absorb enough good nutrients to get it to the place of impact where you really need to heal properly. So you get biochemical disruption there. But what's even worse is, none of those things really fix a mechanical problem. That's the bottom line. You've got mechanical problems in the low back, and a drug's not going to change the mechanics. So you hide the pain, but then you still go out and you do the same stupid things you were doing before that got you into that place without fixing the mechanical piece. You're going to make the process worse. You're just going to wear the disc down even when you're not even going to know you're doing it, and that's the worst part.
Mechanically, that's the biggest fear. When you dumb the symptoms down and you don't think you have a problem, so, I'm a little stiff because you don't feel anything anymore. Now you go out and you really do it in.
Yeah.
And it's gone.
Whether you're talking about NSAIDs, you're talking about a cortisone shot, which is even worse. You're talking about a spinal block, any of those things, you haven't fixed the mechanics.
Well,
you make the problem worse.
The body repairs itself, and it repairs itself by putting in any cartilage in the body, no matter where it is, whether it's a disc cartilage or a knee cartilage or an ankle cartilage. The disc in the low back repairs itself by way of a chemical system called sulfate transfer. And the sulfate ion is what actually repairs the disc. And as we're talking about, what happens when you take any of these medications, it competes for the receptors within that cartilage that allows the stimulation of the disc to begin to repair itself and makes things worse and actually causes the degeneration to advance much more rapidly until the place that you're bone on bone, or you have what we call spinal stenosis, which can happen because of many different things.
Yeah.
Let's talk about spinal stenosis because that's part of the disc. It can happen, and it only happens because of discogenic problems.
Right.
And, people have been putting up with the disc problem for a long time. Now they're ending up with this canal that's closed.
And that's the thing. And you kind of hinted at, you can't ignore these things. It will only get worse. I mean, this is not something you want to ignore. But yeah, you've got different types of stenosis. You've got the little holes on the side of the spine where the nerves come out. Those are called, the doctor word for it is foramen. Okay, so you can have foraminal stenosis. Or you can have what's called central canal stenosis, which is behind the vertebra where the spinal cord is. And it's going to be a disc problem. When you have those things, it's going to be a disc. If it's a foramen, you're probably going to have more problems on one side. If it's central canal, you can have problems on both sides.
The most common symptom that not only low back pain, because we see that there's three different types of presentation. You have low back pain, you have low back pain with leg pain, we call sciatica,
right.
And then we have low back pain by I said by itself, but we have leg pain by itself,
right.
And it's a progressive situation. So just because you have one or the other, and your doc has given you medication that you can adapt to, put up with, and kind of, at least go to work and, it doesn't bother me if I do this. And that drives me crazy. Patient comes in and I talk to him about it. I said, how grade your low back pain for me, 0 to 10. And 10 being they can't move, they're in bed, they're in excruciating pain. 0 doesn't exist at all. And they said, well, if I don't do anything other than, sit at work and take my medication, it doesn't bother me. So you've given up what?
Yeah, so as long as I don't live my life, I'm good.
Yeah, it's I don't play with my kids. I can't go for a walk with my husband. I can't.
Part of that is the fix is so relatively easy, though. I mean, it really is.
It is. It's ridiculous. And we're going to talk about that in the second half.
That's why it's frustrating to hear those things.
It makes me crazy because that is like straight up. And the success rate ranges from 63% to 75%. Don't go away. We have to break for the news. We'll be right back. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. In studio, it's beautiful outside, but we're bringing you some beautiful information, something that you can actually make your life better with instead of the drugs and the potential surgery that you're facing. What am I talking about? We're talking about herniated low back disc or ruptured disc or slip disc or protruded disc, all those things that make life very uncomfortable for you and, unfortunately, in some situations, very debilitating. In studio, Dr. Leonard Poe. He'll be your host, your presenter at the Roselle Center for Healing this Wednesday evening, 7:30 p.m. As always, these in-house continuing education programs, as we call them, are our gift to you. There is no charge for them. All we ask is a reservation because we have limited space. We can fit about 48 people, and after that, we're done, and we can't do it again. So if you'd like to join us, if you have a low back problem, Dr. Poe will take the time afterwards as well to talk about it and see what that can be done. And this is a situation, if you've been scheduled for surgery, you owe it to yourself to check out another course because the risk levels of surgery are over the top. They just don't go away.
Try some conservative care first for this thing. You lose nothing but a little bit of your time.
That's all. It
can't possibly make it worse.
No. There's no way that any kind of decompression therapy.
No.
And we're going to talk a little bit about decompression. Can do anything except help you.
That's the thing. It's conservative. It's simple, and it can no way make it worse for you.
And if you have a question, 888-630-9625. That's 888-630-9625. Love to talk to you and just ask whatever you'd like to ask. Let's talk about one aspect of disc, we talked a little bit about the mechanical disruptions. Let's talk a little bit about the chemical pieces, and just for a couple seconds, because I want people to understand how these discs can swell, and then all of a sudden it takes a sneeze, or you strain too hard, or you bend over to pick up a book off the floor, and then that's the crowning event. But it has to do with the intestinal tract.
Right.
And
you want to talk about ileocecal valve?
I want to talk about ileocecal valve.
Talk about ileocecal valve.
Okay. So the ileocecal valve is that connective piece between the small and large intestine. And it takes food once digested and dumps it into the gut, into the large bowel for it to be eliminated. Now, the problem with that is simply this. Often it becomes incompetent. What we mean by incompetent is simply that it doesn't close completely as you're moving food through, and now you end up with high levels of inflammation.
Yes.
That go to the
That's
low back.
correct.
That go to the low back. I'm not making it any easier for you than that.
Just like anything else in the body, it's a low muscular valve, like you said. It can get stuck open, it can get stuck closed, it can be spastic. But if you're not passing that food correctly, or that waste at that point correctly, it's going to become irritated. It's going to become inflamed. It can lead things to pain, like appendicitis-like pain, and it's going to inflame the area. And then it doesn't just stay locally right there at that ileocecal valve.
No,
it spreads out. Yeah, it's the whole pelvic bowl will become inflamed. And that's going to include the disc. That's going to include all the soft tissue that's supported to hold the disc and the joint in place. And then it becomes loose, and that's how we get to where we are.
Here's an interesting diagnostic piece when it comes to ileocecal valve. We call it open ileocecal valve. It's just basically it's an incompetent valve. And if you go up to somebody and you talk to them and their mouth smells like a sewer, that is pretty diagnostic that says that valve is involved. Your mouth should not smell like a toilet. And when it does, what you're doing is you're getting the lymphatic system backing up, just like your sewer system is backing up in the house. Now, that system goes directly to the spinal disc, and you end up with swelling of the disc, and you end up with the problems that we've been talking about.
So not only with ileocecal valve, but also with our levels of stress.
Stress.
I'm egging you along now.
Yes, I can tell how you are. I can tell how you are.
So let's talk about adrenal function along with that.
We're going to talk about adrenal function, but first we're going to go to the phones because we have some people waiting. Our number here, by the way, is 888-630-9625. Sally, thank you for calling. How can I help you?
Hi. This is for a friend of mine who's had 2 knee replacements, one about 5 years ago, and she seemed to do okay. Then the second one about a year or more ago, complications after surgery from her heart, so put her behind more. Well, now she is hobbling. I feel this is a dynamic woman. She is hobbling. I said, Dorothy, you can't just have physical therapy on your knee. You've got to get that back straightened out.
That's right.
And I'm seeing a lot of people who have these knee replacements. I don't think that's ever dealt with, proper spinal alignment.
It's not, Sally, and I'm glad that you brought up the conversation simply because of the fact that that's what we forget about. Every muscle in the body has a nerve root that goes to it. By the way, it also has an acupuncture system that goes to it. And if either one of those things aren't working properly, then the joint space that muscle controls is not going to work. Dealing with the low back, the third lumbar low back nerve root goes to the thigh muscle, the quadricep, and that thigh muscle goes over top of the knee and inserts into the lower portion of the leg. So when they replace the knee, if that muscle is not working, then the mechanics of that joint replacement can't be functionally as good as it should. So now she's going to have much more pain. The muscles on the side of the leg, on the outside, is called the iliotibial band. It goes all the way down and inserts to the lower portion of the outside of the leg, and that relates to intestinal tract. And that nerve root that controls that muscle also comes from the low back. So you have to take a look, and you're very correct in your assertion that you have to look at the mechanics of the low back to make sure that the nerve roots are freed up so those muscles that surround these joint spaces, particularly after surgery, can be mechanically normal. Otherwise, they're not, and they continue having pain as your friend is. It's unfortunate.
Yeah. And you got to remember that a surgery, you're making anatomical change. Even if it's minor, still anatomical, but change is going to screw up the gait mechanics. You're not going to walk quite right, and that's going to lead into the spinal mechanics. It's a chain.
Thank you so much.
Sally, thanks for your call. Appreciate it. 888-630-9625. My guest in studio, your host this Wednesday evening, the 11th of September at 7:30 p.m., Dr. Leonard Poe is going to be talking to you about what you can do for those low back disc problems that you've had, and, you know, it's not too late. You can fix it. Gwen, how can we help you? Thank you for calling.
Hi, thank you. My fiance has a massively herniated disc, and my dad actually called me and told me to change the channel and listen to you guys because you were talking about it. I guess I missed that part, though. And he's scheduled for surgery this Thursday, and he has nerve damage. His leg gets extremely tired just from walking around. And I was just wondering what you guys recommend.
Okay, let me take you through the progression. We'll kind of retouch on it. Most low back discs are able to be treated without surgery successfully. The success rate is between 63 to 75%. You have to treat it multidimensionally. We use a system called decompression therapy, as well as using our applied kinesiological procedures and acupuncture and the other things that we do in the practice. So basically, Dr. Poe earlier said that if you remember what these little Chinese finger handcuffs look like, they're like a fibrous hatchwork, and if you extend them, they tighten up. If you bring them in close, they open up loose. That's what the disc looks like. It's got this hatchwork of fibers that make this container that keeps the disc material inside, which is like toothpaste, contained. And so what you do to treat this thing is you cause a decompression pumping over a period of time, balancing the muscles, changing the chemistry around it. And as I said, the success rate of those who have been scheduled for surgery, some authors say 63%, some authors will take it as high as 75%. But and I can tell you from personal experiences, I have 4 ruptured discs in my low back, and I have 2 areas of very significant spinal stenosis. These surgeons wanted to fuse my back, and they said that I will never be able to function or walk again. And this goes back 7 years ago this October. And today I work in the practice. I'm in the office every day. I see patients continually. I don't have that kind of pain anymore. And as long as I keep myself in good shape and I get treated periodically and so forth, there's no problem. What I would encourage is this: a trial of conservative care, the way that I'm talking about, hasn't been done, that's the first step. That needs to be done first. You can't lose anything by it. You can always have the surgery, but once you're cut, and there's no resolution.
Right. Okay. Yeah, he's done physical therapy, and that helped with his pain tremendously. And they did some dry needling, and that seemed to help too. But
it can be reversed. Yeah, sure. If that helped, just by you telling me that,
it's resolvable.
It's resolvable. It's something that can be done, because physical therapy is just going to help strengthen muscles, and the dry needling is not the same as acupuncture. It does localize what's called Melzack gate wall pain control. It sends a stimulation to the upper thresholds of the brain to override the pain pattern, relaxes the muscles, so there's not as much compression on that lower portion of the area that they're dealing with, whether it's a joint space in the knee or in the back or any place else. So, but proper spinal decompression and treating the muscular system properly, I think he's got a great chance of resolving this.
Yeah, if he wants to, have him call our office first of the week. I'll sit down with him. I'll go through his MRI, and I'll tell you exactly what can be done for it. It's easy enough. It's quick and easy.
Gwen, thanks. But pass it on. If he wants to talk to us, just give us a call at 703-698-7117. Tell him to get on the phone with Dr. Poe tomorrow, and we'll be more than happy to walk him through it.
Okay, great. Thank you so much.
Thanks for your call. Appreciate it. 888-630-9625. This Wednesday evening, Dr. Leonard Poe will be your presenter. We're talking about low back disc problems, herniations specifically, or fragmentations, as when a little piece of the disc kind of floats around into the canal, or a bubble, a protrusion, where it's just like an ice cream sandwich is kind of beginning to leak outside of its contents. They are resolvable. These things can be done. And if you've been on steroids, you've been on aspirin substances, Celebrex, and so forth, it makes it worse over a period of time. If your dietary patterns are such that you're causing high levels of inflammation, you have a problem. If you don't drink enough water, you're going to dehydrate the disc and you're going to fragment it.
And that's a huge piece of this treatment, is getting yourself better hydrated again.
Most people don't. It's like a sponge.
Yeah.
I tell people, visualize an old sponge. one that's been laying around forever. It's been used off and on over the years, and it's thin and it's brittle, and it can snap and break. But if you take that sponge and you put it in a little dish with some water in it, slowly let it come back in, you end up seeing things changed. Let's go to the phones. Jack, how can we help you?
Yeah, in a couple of weeks I'm going to have an intrathecal pump trial where they will put in a pump and shoot either morphine or the water directly into the intrathecal space.
Oh, my God, Jack, no. What's going on? Give me a history.
I've had 4 back surgery times 4, 1 LAMI, and 3 lumbar fusions, none of which have been successful.
Jack, have you had any kind of conservative care whatsoever?
Yeah, a lot of PT.
Okay. Have you had any decompression therapy? Have you had acupuncture? Have you had anything like that done?
Yeah, I've had acupuncture.
Did that give you any resolution whatsoever?
No, it's just nothing but scar tissue back there anymore.
Okay, Jack, I'm going to ask you some quick questions. Obviously, I can't get into a detailed history, but do you drink coffee or sodas or anything like that?
Yeah, both.
Okay, you got to stop them. You'll never get out of pain ever with those two things in your body. They're both highly inflammatory. They cause the nerve roots, particularly the soda's phosphoric acid in the soda causes the mineralization within the disc spaces and so forth to break down. Coffee is highly inflammatory. If your diet is acidic, what you're doing is you're destroying the joint. You're breaking it down. So that's probably the biggest reason why you can't get any resolution. I would not, if I was in your position, which obviously if you've been listening to the program, I've had tremendous spinal problems over the years. I would not do that until you make some other changes. Would love to talk to you offline. Just give us a call, and you don't even have to come in. Just spend a little time talking to us, and I'd like to help you in any way that I possibly can. Jack, thanks for your call. I wish I could get into a little bit more. We've got to come up for a break, but please do that. Give us a call or show up for the class on Wednesday evening, but don't do that surgery yet. There's other ways. There's other things that you can do. Don't go away. We're coming up for a break. We'll be right back after some very important messages. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle web store. That's drtomroselle.com and click on Roselle web store.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
WMAL-FM Woodbridge, Washington. WMAL Washington. WRQX HD2, where Washington comes to talk.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We're here every Sunday at 12 noon bringing you the most updated and intimate information on integrative and natural therapeutics. There's so much that your body can do. Your body doesn't need any outside help most often. It just doesn't. It needs to be left alone to do what it's supposed to do naturally. If you support yourself structurally, if you support yourself biochemically, if you learn how to tame your emotions, there's so much that you can get done. This Wednesday evening, September the 11th, 7:30 p.m., Dr. Leonard Poe will be your host, your presenter, on herniated low back discs. So if you've been diagnosed, if you've had multiple surgeries, and you're like our last caller where they want to implant a pump to continue medication within his body, not a good thing, not the right choice. There's a reason for the pain. They just medically have not told you what it is nor treated it properly. You have other options if you're willing to step up to the plate and make some changes in your own life. That's what we're going to cover this Wednesday. Please be there. All you have to do is call at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend. If you want to send us a note off the air, rosellecare@aol.com or go to rosellecare.com. One of the two, rosellecare.com. Real easy. Send us a note. We'll get to you. We'll do one more call, and then we've got to close out. Lowell, thank you for calling. How can I help you, sir?
Yes, I have a question concerning the disc decompression therapy.
Yes, sir.
And inversion tables. Because I'm actually in Frederick on a travel from Columbus, Ohio, and I have a herniated L5 disc that's pushing against my right sciatic nerve. Been going through physical therapy for about 6 months, which is doing, fair. But I have good days and bad days. But I've seen a lot regarding inversion tables. But I live in a small condo. I don't got, space is limited, but I do have a total gym, which gives me about a 60-degree angle that I've been using to just try to stretch my back by connecting my feet.
Okay, because of time, let me tell you about the inversion table opposed to decompression. It's not the same thing by a long shot. Decompression will, inversion, if you put yourself upside down, you're going to reverse the lymph flow, you're going to help circulation, you will stretch the spine, but you will not be able to isolate the disc. With true decompression, the way it's meant to be done is that it's like a slinky. It's back and forth, an accordion compression, decompression, and then the doctor, the table that we use Cox decompression technique, and we actually, as the patient's laying face down on the table, we can lock the disc and isolate the protrusion, whether it's to the right side, the left side, or central, and cause a suction technique within the disc to pull the disc back into position. Make sense?
Yes, it does. Thank you.
Okay, give us a call, Lo. More than happy to talk to you about it more in depth. Unfortunately, we're coming up very close. But this Wednesday evening, Dr. Leonard Poe will be your host. You're going to do all kinds of things. Got about 15 seconds to tell everybody that they need to be there with you.
Everybody should be there with me.
Thank you very much. I mean, that's
the thing. At least low back. Be quiet. The low back. You got to remember too. It also applies to the cervical spine, the neck. The mechanics are the same. So if you've got disc problems, please come by. Let's talk about them because conservative, simple care works. It's highly effective. It's the way to go.
We got to go. We'll be here next week. Same place, same old station. See you later. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.